With the ongoing COVID-19 pandemic that continues to mutate with new variants, many things have been acquired and attained in spheres of health, technology, day-to-day activities, among others. Despite the COVID-19 challenge, many achievements have been attained here in Uganda, and in the health sector alone, doctors and medical personnel
changed the way they were providing services, and instead we called women to find nearest health facilities, encouraged them to find nearest health facilities. We actually intensified transporting drugs to them. We innovated. We asked them, if you have a border man whom you can send to the health facility, send them. It has challenges with disclosure, but for that time it worked. There's actually a paper that has been written in Kawempe Hospital about the impact of COVID, in particular at Kawempe Hospital. I think it was released this year, that showed actually that immediately after the lockdown, the services bounced back immediately, and which is a good thing. But that was because of the programs, changing, realizing the challenge early and innovating in order to stop the long-term impact.
Have had to come up with ways to hinder the contraction of HIV/AIDS from mother to child.
The lockdown, the number of women who are attending antenatal care drastically reduced. Okay, so women who are not accessing child health clinics, and so that means those who were eligible for testing could not be tested on time. Okay, those who were already on ARVs could not access health facilities. So that is a very scary thing, because that means they are not going to get their ARVs. Not only life-saving ARVs, but now ARVs that prevent mother-to-child transmission of HIV.
Dr. Emily Namara Lugolobi, who heads the program that fights the spread of HIV/AIDS from mother to child in Kawempe Hospital, has elaborated on the hindrances they have faced due to the COVID-19 pandemic, which include the drastic reduction in numbers of patients who go for medication, among others.
Is virally suppressed, is clinically well. You can give them 3 months to 6 months, and that helps them push beyond. But it has a challenge when they have to come back for viral loads. Okay, it has a challenge when the mother has a baby. Remember, the mother is okay, but the baby needs to come back, and those are the things we learned, the lessons learned in the early lockdown. Our most important thing was give mothers ARVs, they are safe, they are viral load. But we're not assessing babies. So you give mother, so the month is okay, but it will have a challenge if this mother has a baby, because they have to come back to have a checkup, to get their own refills, to make sure that we monitor them if they are growing or not. So you have to tailor according to the needs of the mother.
In curbing the contraction of HIV/AIDS from mother to child, Dr. Emily has highlighted on their aims as an organization, as she advised on how to control the spread of HIV/AIDS. She has further revealed that there is a plan that is underway to have every patient take their medication and to also monitor them.
EMR, electronic medical record system, instead of files, we enter data into an EMR system. So we extended it into the antenatal and also extended it into at labor and delivery, and we learned interesting things. So a mother comes in antenatal. Now you're talking about interfacility. This is the same facility. She comes in antenatal, she's Emily Namara. She comes at labor and delivery with her mother-in-law, she's Reste Katunguka. She's pushing for. So if there was there have been studies that demonstrated the importance of using thumbprints as EMR, I think in Western Uganda. If there was a way of, and now I think it's being rolled out using EMR, the Uganda government is using the national ID as but it will go away in improving care. For me, I focus on the side of improving care.
This story has been compiled by Issa Chigongo for Channel 44 Prime News.